It can feel like the world stops when you or someone you love hears 3 words: you have cancer. You feel fear and shock, a lot of overwhelm and confusion about the medical jargon that you're suddenly trying to understand, or helplessness at the uncertainty of what is to come and what the next steps will be. Although more and more people are surviving cancer, fortunately, due to advances in research and discovery and treatment, it is still the second leading cause of death in the United States after heart disease and is rising globally. However, anyone who has been touched by cancer or any horrible illness, which I imagine is many of us in this room, knows that the person you love is so much more than a statistic. For me, I was living in New York City, pursuing my master's degree in health policy, when I received the call from my sister that my Tío Mickey, my uncle, had lost his battle to cancer. I remember leaving class, and I was going to take the subway uptown to my apartment, and I had stepped off to the side and was leaning against a chain link fence while she calmly told me the news, and we cried together. The cars continued to drive past me quickly on the busy streets. People continued walking to whatever destination they were going to, and the pickup basketball game on the other side of the chain link fence continued. For me, it felt like my world had stopped, but New York City continued to buzz all around me. My memories of my Tío Mickey, my uncle, are very simple but very happy ones. I think about sitting in my father's living room with me on a chair and him across from me, telling jokes, asking me how school was going, making funny commentary about whatever movie or television show we were watching together. And I remember thinking how funny it was that he, as such a silly and carefree person, was related to my very serious and sometimes very stoic father. Imagining if this had always been their dynamic, even as young men and brothers growing up in the sunshine of the Caribbean. And this is still how I remember him: undeniably gregarious, funny, able to make anyone laugh and put you at ease. I remember him not only as my loving uncle, but as a loving father and son and brother. And although my uncle did not survive his cancer ultimately, in many ways he was luckier than most people. Towards the end of his life, for a time, he was able to live with my father, who is a physician, as well as my abuela, or my grandmother, who got to spend that time with her 2 sons. In essence, he had advocates, he had caregivers, he had a community. In my work, I often hear so many stories from cancer survivors and patients and their caregivers and loved ones. And one thing that has become very evident is that every cancer story is unique, and many do not feel the impact of the illness equally, and there are so many inequities and disparities that exist. For example, some stories that come to mind for me is the single mother living in rural America who has to travel hours to the nearest major city to get treatment when she doesn't have it in her rural community, while at the same time attempting to juggle childcare while she's away. Or the young newlywed who can't afford health insurance, and months after what was a celebratory milestone in her life, receives a cancer diagnosis, is plummeted into medical debt, and has to file for bankruptcy. Or the many, many people of color and LGBTQ individuals who live all over the United States who fear discrimination and bias from a provider, deepening their mistrust in the health system, and might skip their screening entirely and then receive a diagnosis when it is more invasive and costly and the quality of their care is impacted. So what do we do to fill these gaps? How do we help these individuals? One way is through patient navigation. Most simply put, patient navigation, or a patient navigator, I should say, is the person who holds your hand during the cancer journey. In oncology, patient navigators are often social workers or nurses by training, although they can also be non-clinical personnel as well. Patient navigators have been shown to increase screenings to cancer through community outreach and education in marginalized communities. They can also help patients understand their treatment options better if they do receive a diagnosis, as well as help ensure that a patient receives the post-treatment that they need in survivorship to continue living a healthy life after cancer. However, unfortunately, patient navigation is not universally available across the US and exists in more of a patchwork across different states. Many cancer centers and hospitals have limited access to patient navigation because of cost concerns and a lack of clinical reimbursement to the services. And so as part of my health equity project, I am attempting to navigate and advocate for sustainable reimbursement for these services across different payers. And fortunately, during my fellowship year, there has been some progress. Most notably, the Centers for Medicare and Medicaid Services, which for those who don't know, is the US federal agency that manages these two safety net programs. So Medicare is for older Americans and Medicaid is for low income and some disabled Americans. This agency created the first of its kind billing codes for patient navigation services. And this was a big deal because it allows providers to bill for patient navigation services across different illnesses, including cancer care. Not only do these codes highlight the importance of these services and help increase access to them, but they also mean that the workforce of navigators can be paid in a consistent and standardized way. The codes didn't happen overnight, however. They are the result of years of advocacy and education about why navigators matter and are vital across the cancer care continuum, from screening to prevention to treatment, and then of course, into survivorship. And making sure that every person has that hand to hold, that everyone has that navigator, is going to be hard. But if I've learned anything from this fellowship year, from this project, and from all of you who are advocates in your own corners of the world, fighting your own battles, is that everyone deserves an advocate, and everyone can be an advocate. So in a way, as I kind of reflect on this time together that we've had in this fellowship, patient navigation feels like the perfect metaphor for what it means to be a health equity leader. All of us, each and every single one of you, navigate people through complex systems every single day. Whether that's as providers in hospital systems that work with marginalized communities that have been disenfranchised for generations, or helping manage health delivery systems, getting medical supplies and vaccines to the people that need them, or training and supporting the workforce that directly does this work on the ground through community health workers, as well as advocating for policies and laws that are based on data and evidence to make sure that these systems are held accountable and truly serve the communities that they're intended to. So as leaders in health equity, we all have the same goal. We want to make sure that people live as healthy a life as possible, despite these complex systems and the bureaucracy that exists that can make that goal feel impossible. I'm grateful that in my health equity journey as I continue, I won't have to navigate that road alone, that I'll have each of you to lean on, all of your wisdom, because none of us can do it by ourselves. Together, across specialty and geography, each of us will build our own roadmaps and create support for our communities so that less and less people have to hear a heartbreaking phone call. Piece by piece, we'll build a patchwork, which will become a tapestry as we advocate for those that feel lost in the maze. We'll make unfairer systems kinder and more equitable, and slowly but surely forge a clearer path. Thank you.